Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into your sleeve or a tissue, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 106,434 confirmed cases of COVID-19 in Canada and 36,178 cases in Ontario. Chatham-Kent has 162 cases, and Sarnia-Lambton has reported 286 cases. Michigan now has 67,237 cases, with 11,805 cases being in Detroit. Today, we are reporting 1,771 cases of COVID-19 in our community, an increase of 46 cases from yesterday. 31 of the 46 new cases are workers in the agri-farm sector. 7 are close contacts of community cases, and 8 are still under investigation. 1,141 cases have now resolved. 518 people are self-isolating. 26% of our cases are between the ages of 20 and 29 years. 24% are between the ages of 30 and 39. And 17% are between the ages of 40 and 49 years. 64% are male and 35% are female, and 1% is unknown. Our community has lost a total of 68 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care and retirement homes experiencing a COVID-19 outbreak. And there are currently 4 workplaces in the agriculture sector and 1 workplace in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers: Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning and thank you for joining us. While our community and conversation have been captivated by COVID-19, we should not lose sight of other important public health efforts. For the first time this season, the Windsor-Essex County Health Unit has identified Aedes albopictus invasive mosquitoes doing routine surveillance in the city of Windsor. Aedes albopictus has been identified across the United States, including Michigan, Ohio, New York, and has been routinely captured locally in Windsor-Essex region since 2016. Aedes albopictus mosquitoes are aggressive daytime biters with peaks in activity in the early morning and late afternoon. They typically lay eggs in and near standing water in items such as buckets, bowls, animal dishes, flower pots, clogged gutters, and old tires. Although the species can spread the Zika virus, it remains a very low risk in our community. The most significant risk to contracting the Zika virus continues to be centered on those who have traveled to Zika risk areas or who have been in sexual contact with these travelers. There is currently no change in the risk for Zika virus in our community. The Aedes albopictus mosquitoes that was identified has tested negative for Zika virus and also for West Nile virus. The discovery of the Aedes albopictus mosquito again this year is an important reminder to everyone that we should continue to protect ourselves and our families from mosquito bites. To protect yourself from mosquito bites, remove any standing water in places such as bird baths, buckets, old tires, pet water dishes, and gutters around your property. Mosquitoes can breed in containers as small as bottle cap. Wear long sleeve shirts, long pants, and a hat when you're outdoors. Light colored clothing is best as mosquitoes tend to attract to be dark colors. Use insect repellents that contain DEET, icaridin, or other approved ingredients on clothing as well as exposed skin. Please always read and follow the manufacturer's instructions. Make sure that the door and windows screen fit securely and are free from hole. Call 311 or your local bylaw enforcement to report standing water observed in your community. The Windsor-Essex County Health Unit will continue to conduct mosquito surveillance in Windsor and Essex County. For more information on Aedes albopictus mosquito, visit our health unit website at www.wechu.org and type Aedes albopictus in the search box. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with Blackburn.
Yeah, I'm just wondering if there's a concern now currently with the number of community cases, and what's the threshold, I guess, to say maybe things need to be clawed back again? Is there a concern now? 15 possible community cases seems like a high number compared to some of the numbers that we've been seeing previously.
So 7 of these cases are family members and are close contact with a confirmed case. So it is not unusual if in a large family, if someone get infected, then the rest of the family members potentially are already exposed, and there's a high probability that they will all come back positive. So yeah, that's that half of the story. The other half we're still investigating in terms of figuring it out how they're connected or linked with either any community case or any close contact. So those are definitely the concerns, and as we've been talking about it, the other important concern is now more and more people are outside, more and more businesses are open. There's more opportunity for people to interact with each other. There are more opportunity for people to go to these business establishments and maybe congregate in groups. So it is absolutely important that we continue to use all the public health measures that are in place, including physical distancing. That's the most important measure that we need to recognize. If people are sick, they need to stay home. In addition to everything else that we're talking about, frequent hand washing, respiratory etiquette, and ensuring that you are not going out when you're sick. So all those measures combined, it will definitely help in keeping our community safe. And we will be closely monitoring and linking all these cases to ensure that we're not seeing something that is unusual. And if there's any opportunity for us to contain, either through public health measure, through messaging, through health promotional messaging, we will continue to do that work for our community.
Are you noticing, or are the people who make these phone calls noticing, like, that people are having more close contacts now, or you're having to trace more, call more people once you have a confirmed case?
Yeah, generally speaking, I think that's the impression that we are getting is people are getting a little bit more relaxed in terms of number of contacts. And when we initially said that the close contacts need to be limited to 5 people, that means 5 people are exclusively connected with each other. Now that circle is expanded to include 10 people, but 10 people also includes your 10 family members, and it's not that you are connected, but someone is connected to another social circle with another 10 people, and then someone from that person is connected to another 10 people. So I think it's important to know that the 10 people that are part of this social circle or close circle, they are all exclusive to this particular group only and not to other group. It is in the best interest of everyone to ensure that our social circle continue to remain as tight and as close as possible to prevent a major spread among one circle to another. We have seen it in other areas as well. In other jurisdictions, after a result of a party, many people got infected. So we definitely want people to remind that if you have more people in your close circle, the likelihood if someone is not following or if someone is sick, they can potentially infect the entire social circle.
Any questions from AM 800?
Dr. Ahmed, Windsor Regional Hospital just sent out a release talking about the assessment center extending the hours after a record number of people going there yesterday. Was the health unit and others in the health industry expecting those numbers to go up once Windsor-Essex entered stage 2? More people would be getting this test?
Well, we want more people to get tested, especially if they have any concerns, if that either they are symptomatic or if they've come across with someone who could be potentially a case. So I think then those numbers will continue to give us a better understanding of what's happening in the community. Some of the increases that we're seeing right now is a result of people needing to go and meet their loved ones in long-term care homes. And some of the numbers are being driven by that. Some of the workplaces are taking proactive measures to screen their employees. So a combination of all of that is driving some of those numbers, which gives us more data to work with. So it is something that I think will help us in better understanding what's going on in the community.
When it comes to the agri-farm sector, Southwestern Public Health issued a class order yesterday. Did you get a chance to look at theirs, and what's the difference between theirs and the order that you put in place?
So our orders have been there for a long time. Like it's almost like we're coming close to a month and a half or longer since we initially issued the order. And our order touches on many of those aspects. Some are very clear cut that we want them to follow. There are a lot of memos and guidance that we have already provided. Some of them may not necessarily be reflected in the order, but those communication and those conversation has been going since the month of February. So we have, and many of these jurisdictions are basically using our order as a template to build upon what they want to do. So it's not in a nice way, but something that we have done already, and the others are basically just using it to build up their order. So we want to make sure that people understand that it's us who initiated that, who took that step when no one else did, and then now people are definitely using it and catering it to based on what their local needs are and adapting it as necessary.
Thank you.
Any questions from Windsorite?
On the province's COVID website, they are saying that there are 1,320 cases that are resolved in Windsor-Essex, but the health unit is reporting 1,141 today. Do you have any idea why those numbers would be different?
So good question. Some of those numbers, I think it just depends on how the report, how they are using that data from the lab and using some of the analogies based on how they are making that calculation. So R is the whatever data is available to us, and based on our follow-up, we clear those cases. And I think there may be some cases that are already been reported because we are not getting all the negatives and any follow-up. So there are some data issues, but I would say that our would be much more accurate because our team is connecting directly with these people. There may be some variation, but those minor variations shouldn't change a lot. Sometimes we do not clear the case if they continue to present with symptoms, and until they're even after 14 days, if they have even some lingering symptoms which doesn't fit into our criteria to say that they're cleared from infection, we do not remove them from our resolve list. So I think there may be some differences in terms of how these numbers are calculated. I would rely more on what our numbers are because our team is connecting directly with these people.
Do you have any idea why the province wouldn't just take the numbers from local health units as the most accurate and put those as part of what they put out?
So we do provide that number and upload that information to Public Health Ontario, and then Public Health Ontario sometimes collate that number and transfer it. But they have other data sources as well. So I think just because there are a number of data sources that are currently being used, there may be some variation, but that's something that maybe we can raise and see how we can get that consistent across the board.
Any questions from the Windsor Star?
Do you have any idea, Doctor, what those other data sources might be that are going to the province?
So the oldest data set, which is basically the Ontario lab system, they use that data set, and again, sometimes, as I said, maybe they're just using the 14 days timeline since the original diagnosis, and from a positive that these cases should be resolved, and sometimes even let's say at day 14. Our team is trying to follow up with individual to make sure that they continue to be asymptomatic. But let's say if we call them and if we can get hold of them, we do not clear them until we talk to them. And maybe that takes us more than 14 days to 15, 16 days until we get there. So there are so that's one source. And I'm not sure that what their other sources could be, but something that I think we'll definitely have to connect with our EPI to make sure that we can use. We use the IFIS database, which is the Integrated Public Health Information System. We upload and put all that information on that database. That's picked up by Public Health Ontario and then reported to wherever they need to.
Thank you.
Any questions from CTV?
Yes, good morning, Doctor. Just curious, I noticed that you guys opened the isolation facility in Leamington at the arena. Just wondering what the status is on that right now. Like, I assume nobody's in it right now, but will it be used, and if so, how soon?
So Bob, so thank you for that question. So that facility is opened by Essex, County of Essex in collaboration with the local municipality. And obviously Health Unit was involved in the initial dialogue of bringing in those 50 pods that Bruce Power is donating to our region to support with that. The idea for that isolation unit was to keep the positives, especially those who may need an ongoing health assessment and who may need more close monitoring to ensure that they're not that they are all at one facility and their basic needs are met, such as their isolation requirement, and also any their food or any other need that they may have. So having them in one place will give us better control in ensuring that their basic needs are met. So that's the initial idea. But right now what we are seeing is we need places for both. The positives, which can be isolated at that isolation unit with appropriate medical and other support, and then you also need places to house negatives that are identified as close contacts but can turn to positive anytime. So the need has gone bigger, and then what we are trying to do is we're trying to provide the best support to each group that needs. So the positive probably need more support in terms of the medical care, and the negatives need more support in terms of some of the other activities such as fresh air breaks, food, and ensuring that they're assessed in a timely manner if they start to show symptom. So it's just a function of what we need in the community, and as we know with one of the farm outbreak, we needed 180 or so isolation rooms for each of these individuals in the region, and then with additional cases that need can go up to all the way up to 200, 250, and so that can be a challenge. So having all those access to the resources from the province and also the local community coming together to support everyone. So that's a good sign, and we hope that once this isolation unit is operational, and if it's needed, we'll start to utilize them to contain the outbreak as well as to provide the care that all these workers need.
All right, so I know a lot of people are in isolation right now in hotels and motels around town. Just curious, how many right now are in isolation? Do we have a number on that?
So as I said, I can say we're looking at somewhere between 250 to 300 people in isolation in the hotel motel area, and many of them are negative, but they are identified as close contacts, so that's why they need to be separated. So if any of them develop COVID, they're not infecting the rest of their group, so which could mean one case can spread to like maybe 10, 15 or more. So that's the strategy that we are using to ensure that even if it's passes on to the close contacts, those number of close contacts is limited and able to contain it in a timely manner.
Okay, and then lastly, real quick here, the status of the field hospital at Sinclair. You don't anticipate having to use that for this case, that's happening out in the county, do you?
Well, the field hospital, it was initially designed to serve as an overflow of the acute care beds in the region through strong public health measures and also great support from the community in following all of these measures that public health proposed. As a result, we never saw the surge in the acute care system. So thank you for that to all the community members who helped to achieve that goal. But that facility is available, I think, still. And if we get to a stage where someone needs medical care that exceeds the capacity of the health system, then my anticipation is that can be used. But right now, as we report every week, our capacity at the acute care hospital is below 85%, which is the provincial goal, and that capacity is maintained. Even from an ICU perspective, the ICU beds capacity is below 50%, which is also something good that from a health system capacity perspective that we are doing good. So hopefully we won't have to use the field hospital at Sinclair College, but if needed, I think the system is in place and that can immediately be activated.
Okay, yeah, I've been told that they're holding it for you, so good to know. Thank you.
Any questions from CBC?
No, thank you.
Any further questions from Blackburn?
No, thanks.
AMA 100?
Is Teresa available today?
Yep.
Teresa, I asked this question yesterday, but I think you stepped away. Just looking for some information. We talked to CUPE in regards to a possible confidentiality breach involving Isler Lodge in Essex and the health unit. Wondering how something like that happened.
Wondering how, sorry, the last part?
How a breach like that could happen involving the health unit and the lodge involving an employee.
So I won't speak specifically about the investigation going on right now, but as you can imagine, with information going back and forth to long-term care homes, both residents and staff, and to the actual facility, there is a potential of sharing information that is not for the intended person. And so we do take all of these, the privacy and test results and breach of private information very seriously, and we'll work with all parties to mitigate the risk of that information getting further than it should be, and to work with the person whose information was breached and try to prevent this from happening again.
The person at Essex, has the health unit talked to them and issued an apology to that individual, or where do you? I know you can't get into details like you said, but where do you stand on that?
So we have a very detailed breach policy internally, and if the breach occurs, it's identified and mitigated and contained as quickly as possible. Anyone whose information is breached is notified either by phone or a letter and made aware that this incident, this has occurred, and next steps, and it's explained to them what we've done to contain the breach, what exactly was involved with the breach, like what information was inadvertently shared, to whom, and so there is a process, and the people involved are notified.
Thank you.
Rob, if I can add to what Teresa said then, and maybe you can go back and listen to some of our previous comments as well. We do take all these breaches in privacy information very seriously. There's a lot of need and interest in among people, communities, organization in knowing data about positives, whether we are talking about a workplace, whether we are talking about individuals. There's always this need, and we do take that responsibility very seriously, and we try our best to contain the information in the best possible way. So I want to make sure that the community understand that whatever we are doing at times may sound that maybe we are not disclosing some of this information, but these are because of those privacy reasons, because we do respect personal health information, and we want to share it only with those who need it unless in the case of some kind of an emergency. So we have good system in place, and as Teresa mentioned, many of these detailed investigation help us in understand and even make future policies to ensure that that information is tightly controlled.
Thank you.
Any further questions from Windsorite?
Just one more question about the province's data. I'm just looking again at their numbers, and there's a cases by location graph where this information is. They're actually reporting one more death for Windsor-Essex than the health unit is reporting. Do you think that's a mistake, or has there been an extra death?
So I think that was discussed before, and there was a discrepancy in terms of what they are reporting versus what we were reporting, and we clarified. I don't remember all that detail, but I think that happened like maybe 2-3 weeks ago when we explained the discrepancy, and I believe that our sorry. Yeah. So what we reported is, yes, they had a COVID. So one person in particular was a positive case for COVID sometime in the past, but then they died of something else. And the way we reported it is as non-COVID, but the province captured it as COVID. So I think this is something that, as we move forward, we'll get more clarity in terms of how these deaths are reported and recorded. Because it is important that someone who had a COVID diagnosis, if they die a month from now, 2 months from now, 3 months from now, or 4 months from now, how would you code it? Would it be a cause of death as COVID or something else? So I think those details are being worked out, but that's the difference that we explained previously as well.
Okay, thanks for clarifying.
Any further questions from the Windsor Star?
No, thanks.
CTV?
No, I'm good. Thank you.
CBC?
No, thank you.
Thank you, everyone. Have a good day.
You too.